Hi, future nurses, and welcome to this comprehensive review. Today, we will dive deep into some of the most important cardiovascular medications used in nursing practice and commonly tested on the NCLEX. Understanding these drugs is much more than just memorizing names. Before we look at how these medications work, we must first understand how the body normally controls blood pressure, blood volume, and cardiac output. Because once you as a nurse understand the underlying normal physiology, the drug mechanisms and their side effects become much more logical and easier to remember during a high-stakes exam. Let's start at the beginning with Section 1. Normal blood pressure regulation. This is the foundation for everything that follows. Simply put, blood pressure is the force of blood pushing against your artery walls as the heart pumps it through the body. The body is constantly monitoring this pressure to ensure that vital organs like the brain and kidneys receive enough oxygen and essential nutrients to function. So, what happens when blood pressure falls? When it becomes too low, the kidneys are the first to detect that reduced blood flow. In response to this drop, special cells within the kidneys release a powerful enzyme called renin into the circulation. Meanwhile, the liver is constantly producing a protein called angiotensinogen. It's always there, waiting for a signal. Once renin enters the picture, it converts that angiotensinogen into a substance called angiotensin-1. As this blood continues its journey and flows through the lungs, it encounters another critical component of this pathway. An enzyme called ACE, or angiotensin-converting enzyme, converts that angiotensin-1 into the much more potent angiotensin-2. Angiotensin-2 is extremely powerful. Its primary job is to cause widespread vasoconstriction, which immediately works to increase blood pressure. But it doesn't stop there. It also signals the adrenal glands, located right on top of the kidneys, to release a hormone called aldosterone. Aldosterone tells the kidneys to retain sodium, and as we know in nursing, where sodium goes, water always follows. This water retention increases the total blood volume, which further raises the blood pressure back toward a normal range. So to recap, low blood pressure triggers renin, which leads to angiotensin-2, which constricts vessels and uses aldosterone to retain water and raise pressure. Here is a vital NCLEX memory tip. Remember this sequence of organs: kidney, liver, lungs, blood vessels, and finally the adrenal glands. Now that you have a firm grasp of the normal physiology, let's see exactly how ACE inhibitors intervene in this process. Common ACE inhibitors you will see in practice include lisinopril, enalapril, ramipril, and captopril. Notice they all share a common suffix. The name says it all. ACE inhibitors block the ACE enzyme right where it lives, inside the capillaries of the lungs. By blocking this enzyme, we prevent the conversion of angiotensin-1 into angiotensin-2. This allows the blood vessels to stay relaxed and open. In patients with heart failure, this is a lifesaver. It reduces the resistance the heart has to pump against, making its job much easier. However, ACE also normally breaks down bradykinin. When it's blocked, bradykinin levels rise, which can lead to that characteristic dry, nagging cough. On the NCLEX, watch for these key side effects: that dry cough, high potassium or hyperkalemia, low blood pressure, and the serious risk of angioedema. As a nurse, your priority is to monitor blood pressure and potassium levels closely and always assess for any sudden swelling of the lips or tongue. Crucial safety point: ACE inhibitors are contraindicated in pregnancy. To remember this class, just look for that suffix, PRIL, like lisinopril. Section 3 covers ARBs, or angiotensin receptor blockers. These target the same pathway but at a different checkpoint. Rather than stopping the production of angiotensin-2, ARBs block the receptors where angiotensin-2 would normally attach and do its work. Common examples include losartan and valsartan. A huge benefit is that they don't affect bradykinin, so that dry cough is much less common for patients. Moving on to Section 4, diuretics. These are our primary tools for removing excess fluid and sodium from the body. Loop diuretics like furosemide are extremely potent. They work by blocking sodium reabsorption directly in the loop of Henle. Because they are so strong, you must monitor for low potassium and even ototoxicity. Always assess lung sounds and track daily weights for these patients. On the other hand, potassium-sparing diuretics like spironolactone allow the body to remove fluid while keeping that vital potassium. But watch out for hyperkalemia. Now for Section 5, beta blockers. These medications are essential for managing how the heart responds to stress and adrenaline. By specifically blocking beta-1 receptors in the heart, they effectively slow the heart rate and reduce the force of each contraction. Nursing priority: always check the heart rate before giving these. If it's below 60, you must hold the medication. Most of these end in LOL. Finally, Section 6, calcium channel blockers. Remember, calcium is the key that unlocks muscle contraction in the body. These drugs block calcium from entering cardiac and smooth muscle cells, which allows the blood vessels to relax and lowers the workload on the heart. Common examples include amlodipine and verapamil. Be on the lookout for peripheral edema and dizziness as common side effects of this relaxation. A critical NCLEX point, extended-release tablets like XL or ER must never be crushed. Crushing them releases the entire dose at once, which can be deadly. In summary, cardiovascular medications work by elegantly altering the body's normal physiology to protect the heart and regulate pressure. When you understand that physiology first, the pharmacology becomes a logical extension of what you already know. You're going to be a great nurse. Thank you for joining me for this review. Good luck with your studies and your upcoming exams. You've got this.